There's MAGA and there's MAHA. And we have a senior advisor to MAHA with us, Make America Healthy Again, which is becoming a household word, acronym for sure. He's the co-author of Good Energy. Calley Means at the White House with us. How are you?
I'm great. We're winning. We're winning.
Tell us how we're winning.
Well, it was a year ago yesterday that Bobby Kennedy walked out on a stage, very surprisingly to many people, in Phoenix, Arizona, and joined hands with President Trump. And I don't think anyone could have imagined the success in the past year. I think the greatest reforms to food policy and healthcare incentives in modern American history, but I think more important, and I think what will be the great legacy of this administration, is it's legitimized a cultural conversation around dinner tables across the country about basic things, bipartisan things, what we're eating, why kids are getting sick, maybe kids should be on less drugs. You know, these conversations that Americans are having about, we are the sickest country in the developed world and spend 4 times more on healthcare than Europe per capita. And this is a big civilizational issue. It's not about getting more drugs to kids. It's about really asking deep root cause questions. And I think that's happening right now. And I think the administration's really proud of that.
You're driven by a story related to your mother. Tell folks a little bit about how you became so passionate about this.
My mom, I think, was the typical American patient where she was taking a hike, had a pain in her stomach, went in, got a scan, and realized she had stage 4 pancreatic cancer and would die soon. And the doctor, her oncologist, said, this is a tough break because you were relatively healthy. But my mom was on 5 chronic disease medications. She, standard medication. She had high blood sugar, she was on the metformin, high cholesterol was on the statin, high blood pressure was on the ACE inhibitor, she was battling obesity. But that's standard, right? That's average for an American. But all those drugs were prescribed in a 15-minute appointment where they said, go on your way, no problem. And I couldn't help but think, with the wisdom of my sister, who was Stanford med school educated, surgeon, left the system, put these pieces together, that if my mom was incentivized to ask why she had high blood sugar, why she had high blood pressure, why she had the high cholesterol, and actually understand how to modulate that underlying metabolic dysfunction, she'd still be here, because that's leading to cancer. We have the highest cancer rates of any country in the world. The United States. Interestingly, Iowa is the highest of any state. So Iowa's actually the highest rates of cancer of any place in human history. So there's something going on. And my sister and I, after my mom's death, 12 days after diagnosis, me coming from more of a political standpoint, seeing how the special interests would occur from a medical standpoint, started talking about these issues, met Bobby Kennedy, met members of the Trump campaign. And there was a real moment, I think, where these issues are being asked by many people. Something isn't quite right. And I think it's I'd call it spiritual, what happened with President Trump realizing this, with Bobby Kennedy. And these are eminently bipartisan issues we're talking about healthy food for kids. I mean, in private meetings at the White House, we're literally talking about how can we inspire kids to eat whole food. That's really what this is about. We've had a lot of wins on that. And for whatever reason, the left has abdicated this issue, and because of Trump derangement syndrome, is actually arguing kids should be eating ultra-processed food. So it's an interesting environment we're in right now.
We've caught the wave where we live in North and South Dakota, Minnesota, and are doing MAHA-like events even with all kinds of wellness folks. How do we make as big an impact as possible in our region and surrounding areas to do more of this?
I can't emphasize this enough. One of the biggest wins of the past 6 months is that local and state governments are waking up on MAHA and pushing local initiatives. So I would tell everyone, the greatest pride we have in the MAHA movement is when we hear from moms who worked with their local school to do more partnerships with the local farmers, to have more whole food. I want to tell everyone, you can have an impact on state laws. We've had 30 states pass MAHA laws in the past 6 months. 22 states have removed soda and candy from food stamps. We've had 20 states do bills around, better education and better school lunches. The lawmakers and governors tell me all the time that they get more calls from voters on these MAHA issues than any other issue they face. I'm actually going to Texas with Secretary Kennedy on Wednesday. We're going to have the governor of Texas sign a big MAHA bill that he said was the single most lobbied against bill from all the food, big food, but he's still signing it because of the MAHA voters. So I think actually this is an issue where the local involvement both is spurring change, but it's giving the administration and giving Bobby Kennedy and President Trump that leverage to drive more change. I'll just give you one example. A bunch of states are saying the federal government's too slow. We want better transparency on food labeling. There's a state patchwork now. That's allowing the administration, because companies don't like the patchwork, to drive real positive reform on better food labels, which is a conservative principle. I mean, we should just have transparency into our food. So get involved at your school and local and state bills. That really helps us here.
And beyond the labeling, how about incentivizing companies to, make clean food, free of seed oils and all the other things we're concerned about?
Yeah, well, we look hard at incentives. I think that's been a really important part of this MAHA movement. We're not coercive. It's not nanny state. But where the government's spending money, we should have an opinion. And that's why I'm really excited about the nutrition guidelines coming out. We're going to have radically reformed nutrition guidelines that recommend whole, good food for kids. And that filters down into school lunch procurement, military procurement, government procurement, and sets culture well. Also, you mentioned seed oils. I have my opinions on seed oils. I think they're problematic. I think a lot of ingredients are problematic. And there's a lot of science that's occurring on that. But the fact that the free market is waking up, the fact that food companies are dramatically shifting their ingredients, lowering their sugar, replacing the seed oils, higher protein, higher fiber, that's a really positive thing. And we were just meeting with large soda companies. And many of the leading soda companies, 50% of their revenue is going to come from zero-calorie drinks. And they're actually doing pretty well. They're responding to consumer demand. So it's a little outside the policy realm, but I think voters seeing Secretary Kennedy, President Trump talk about these things, this unlikely collaboration, has led, I think, to individual decisions. And that's another thing I'd just say. This is a teamwork here. This is a teamwork between the administration and the American people continuing to demand change. And the more Americans can vote with their wallet and change the market, that's going to be a key part of the progress that we drive.
Speaking of seed oils, we come from corn country, soybean country, obviously, and as soon as you bring that up to folks in the agriculture world, that you realize, the challenges there, and they also push back a little bit on the health concerns as well. I saw some things recently that Bobby Kennedy Jr. said that alarmed many people in production agriculture to say, wow, wow, wow. What do you say to the concerns from our ag community and the processing people, and also the global trade people that say we've got a world to feed?
What I'd say is that it is impossible for this MAHA movement to be successful without the success and thriving of the American farmer. That's just the truth. What I credit the Trump administration so much for is that they're embracing these messy, complex conversations. And we have a really daunting issue where clearly chronic disease is exploding, and it's tied somewhat to our food system. And nobody disagrees with that. But we also have a situation where, let's take farmers. They're existing and operating under a very broken set of incentives and government policies that have been in place for decades. And it's not their fault. Farmers are taking it from all angles. They've got bad weather, low commodity prices, a ton of government interference. So this isn't a punitive thing, specifically with farmers, to lecture farmers. Bobby Kennedy and people in the MAHA movement have spoken out and have certain opinions on pesticides and other things like that. But it's never going to work to tell a farmer we're taking away your tool, we're changing anything dramatically. We're having an ongoing conversation. So it's a push and pull and a discussion with these industries, and it's different for different industries. But with farmers, I'll say, Secretary Kennedy, me, his senior staff, we've had 80 meetings with farm groups in the past 3 months. And there's going to be probably some tough conversations, but there's a lot we can agree on. And this MAHA report that's coming out next week with the president is going to signal soil health as one of the preeminent goals for this administration. And farmers want good soil health. They want to be growing more with less inputs. I mean, there's a lot that we can agree on. So we're going to focus on that with the agriculture community. And also, I would say, as farmers note all the time, that they will grow what people demand. And we've got to work on those, where the government's spending money on our public health messaging. If Americans keep wanting to eat healthier food, that's what they're going to get.
You hear also a lot about the cost of eating healthy. Do you think that, again, the trajectory for the consumer is going to see that number come down? Or I guess the overall cost compared to walking in a grocery store and buying Kellogg's, It's
a great question. So MAHA to me is a 10-year goal, and what we're really trying to unwind is that we spend so much on chronic disease tied to food. The cheapest thing we could possibly do is make sure that healthy, good, local American food is affordable, and it's not in many cases right now, and that's a huge problem. So what I'd say to voters is that there's been more success in the past 6 months than we've seen in modern American history. We're reforming SNAP, we're reforming Medicaid, we're getting better nutrition guidelines, we're reforming the FDA standards for food regulation, labeling. There's so much happening, but this is a long fight. What we're eventually trying to get to is why are pharmaceutical companies so rich? And if your kid is on Medicaid and has diabetes, the government will just, without thinking, pay tens, hundreds of thousands of dollars for that person, but we're not fixing the root cause. We're going to get there. We're going to get to the incentives over time. I will say it is incumbent, I think, for Americans to know, and I'll just be honest from being inside, these are broken systems. There's a deep state that wants our kids to be sick. It's just that simple. And I do think this messaging from the administration to Americans, you need to try to feed your kids whole food. You need to really think about your kids' diet. We tried to write about it, Good Energy. There's a lot of messaging coming out. I do think Americans, the more they can vote with their wallet as we're fighting change on the inside, the more things are going to change.
Let's talk a little bit about tax policy, insurance companies. Insurance companies will sort of do this on the surface, gym membership or whatever. Right now, including Medicare, the only pain relief, reactive care is the stuff that's covered, right? Just treat the symptom rather than try the root cause. Do you think anything can be done to transform on the insurance side?
It's all we're talking about. So right now, the American Medical Association creates the codes for Medicare, Medicaid, which then go to private insurance. The American Medical Association is a pharmaceutical lobbying group that demonstrably profits from Americans getting sick and then taking drugs and doing procedures to manage that sickness. Our entire health architecture and our standard of care is predicated on Americans being sick. And what the administration is doing, Dr. Oz at CMS and others, is looking for ways to provide patients more flexibility. Drugs might be useful in some cases, but somebody dealing with heart disease, diabetes, obesity, there's also a root cause to that. Exercising, eating healthy will make them do better, but we don't incentivize that. So there's a number of examples. In the One Big Beautiful Bill, we've expanded more flexible options. Dr. Oz will have a number of announcements soon where we make Medicare, Medicaid more flexible so people can choose to invest in the root cause. But that is the foundational North Star goal of where we're leading to. Looking at that $5 trillion and asking how can we actually use that money in the most efficacious way to incentivize real health. And I'll be honest, that is a long-term battle because that's really getting to the foundation of the incentives for the largest industry in the country. It's why people are fighting this so much.
My business partner and I see a line item that grows every year and it's healthcare expense.
100%.
What can we do? What can other businesses do to say, okay, insurance companies aren't going to do it, but we're going to lean in on wellness. We're going to hand you a copy of Good Energy. We're going to buy you a wearable. What kind of things can, obviously, this administration, President Trump would probably have the most influence there versus over insurance companies. What could be done in that regard?
I mean, I would really educate your employees about HSAs. I do think that's one example where patients can have flexibility with the way they spend their healthcare dollars, and that's been expanded in the One Beautiful Bill, and I think that's an important area. I think that the more companies can incentivize root cause interventions and look for there's actually a preponderance of new medical insurance models that reward employers for incentivizing their employees to do the right thing, but the fundamental issue, as you said, is that we're paying for all of it on the back and we're paying to manage, but we're not paying to reverse and prevent, and we're battling the incentives on that. But the more employers can, and just individual Americans can continue this cultural awakening to get employees healthier, the better.
I have a friend who recently told me that their fourth child, the baby was 4 pounds and some change, and the siblings of the baby had all been 4 pounds and change. The parents are skinny, but the primary care doctor said, something's wrong here. We want to hospitalize the baby at a month or so old, and all they did in the hospital was actually watch them feed them. Then they started insinuating that the parents were partially responsible for that, and shaming the parents because the vaccines at birth hadn't been administered, and the parents were like, pump the brakes, we just want to know a little bit more about that. Somebody in that spot, what should they do?
You should go with your own intuition. You should go with your own intuition. There's a really important moment happening where patients are asking more questions to their doctors right now, and I think that's really important. I had a leader of a large medical group with thousands of doctors complain to me because she said 5 years ago the average appointment length was 8 minutes because everyone just took their prescriptions. Now the average appointment length is 15 minutes, and 80% of patients are asking questions about natural causes and what the root cause is. That's a good thing. The medical community has let us down. It is completely appropriate for parents to be asking questions about 79 injections that they're being told to put in their kids without questions, particularly if that kid is immunocompromised or has some other health issue. That's according to the CDC right now. They say you should be asking questions and coming up with a personalized protocol based on your children's conditions. It is absolutely wrong, potentially even illegal, for doctors to coerce parents into going into a medical intervention. And the way I look at it, and this is certainly what Secretary Kennedy's been saying, has the medical industry deserved trust after COVID? Do they deserve trust when we are the sickest population in the developed world and continue to spend more? My framework is that when it comes to chronic issues, something that's not going to kill that child right away if you don't do it, more of a long-term issues, diabetes, obesity, eczema, like you go down the list of things that are nagging all these parents face. That's most of what parents are dealing with. You really should use your intuition, get second opinions, think about it a little bit. When it comes to acute issues, if your child has an infection, is about to die, or something that's extremely acute, I would definitely listen to your doctor. But I think that's the awakening that's happening right now. And there's been a torrent of activity from this administration to improve medical freedom. Secretary Kennedy recently announced, that doctors make millions of dollars of incentive payments for doing the vaccines at the right time. It's actually a huge part of pediatricians' budget. It just doesn't make sense. Not even speaking to, the validity of vaccines, that doesn't feel right for doctors to be making millions of dollars for issuing a pharmaceutical intervention. That's why for a premature baby, that clearly has some other issues, those products are being forced on them right away without any nuance. So we're attacking that on the policy end, but we really support the cultural awakening where people are asking questions to their doctors.
If anybody has gotten 15 minutes with their primary care doctor anytime, they should go out and buy a lotto ticket because they've won just there. We have a new, first in its kind, in North Dakota, direct primary care provider now, outside of insurance, 24/7. Text us, email us. You'll pay our cost on scans. Is that the wave of the future, do you believe?
I think more flexibility for patients, more innovative direct primary care models. I want to see more functional medicine clinics in lower income areas where people can get more blood tests and understand what's going on inside their body. I think there's been a denigration of more root cause or holistic methods. Sometimes acupuncture or dietary coaching is better than going to the doctor. I want to see much more competition in the healthcare space. We do not have a free market healthcare system right now. We have a kleptocracy, I think. We have a corporate-driven system that profits from people being sick. So that's what the administration's asking. We have healthcare policy issues, and Dr. Oz is asking, how can we just let entrepreneurship and innovation bloom in our healthcare system? When it comes to medical schools, there's really only one group that can credential medical schools right now. It's very conflicted. We're looking at ways to have other credentialing methods for medical schools. So that to me is the key, is flexibility, competition. They're actually very conservative principles. I think Americans want to be healthy. I think people want their kids to be healthy. We spend a lot on healthcare. If we could just have that money go to flexible options where patients can make the best decisions for themselves without being coerced into the sick care system we have, I think it's a big part of the solution.
Last question I want to ask you, we have a lot of Native American population in our part of the world, and of course they have federal health care. It makes me openly weep to see the level of health condition, the amount of diabetes on tribal lands and among enrolled members. I know Secretary Kennedy has a great passion for this. Rumor has it he's coming to North Dakota soon at the invite of Senator Kramer, which will be wonderful. But speak to the Native American community and what can be done given this crisis.
Secretary Kennedy has said and says to me and makes clear that one of his great legacies is reforming the system for our Native Americans and reforming the Indian Health Services. It is something he is obsessed with. And I think it's just one arm of the tree that we have of a system that's been totally co-opted. You look at that, you look at the VA right now, which is a mess. 40% of veterans are diabetic, full-on diabetes. I think it's similar trends for our Native American populations. So we need to have those same principles. I know they want to be healthy just like every other American. They are living under really dark incentives, and Secretary Kennedy is going hard at that issue. We want to have great flexibility. We want to have options and availability of better food. We want to change the incentives to address the root cause of disease because we know people want to thrive.
We appreciate what you're doing very much. Thanks for the time.
Thank you, sir.